actually, when I woke up the next morning, the doctor came and told me. So I had no clue that I went through surgery. I don't know what it was, how it went. I woke up in the morning and I was told that yes, you did have there was cancer. So
what did you think at that moment? Because zinda rahungi, nahi rahungi. Sorry, it's a very blunt question. It's a very blunt question. That way, I'm sorry about it. But
no, that's fine completely. There's so much thought. Actually, everything happened so fast, and. It didn't process me to that level deeper till later on, actually. So I'll tell you why. Because before obviously everything happened, I was diagnosed and I went through all these things. In January of that year, I had signed up for a mountain called Mount Elbrus, which is in Russia. I basically do high altitude mountaineering. And I was so focused, I was training and I was so focused that I need to go and climb this mountain. So after my surgery, and probably after a month, I asked the only person I asked is my doctor and my husband. I said, I want to still climb this mountain. And both of them, my doctor said, he just said one line. He said, if something that makes you happy, go for it.
अस्सलाम वालेकुम। ये अक्टूबर का महीना है और अक्टूबर का महीना क्यों इम्पॉर्टेंट होता है? ब्रेस्ट कैंसर अवेयरनेस मंथ है ये। ब्रेस्ट कैंसर के ऊपर बात वो कर सकता है जो इससे गुज़रा हो, जिसने इसको देखा हो करीब से, इस बीमारी को, और इससे लड़ा हो। हमारे साथ आज जो गेस्ट हैं वो बहुत स्पेशल गेस्ट हैं। शी इज़ अ फाइटर, शी इज़ अ सर्वाइवर, और वो इस एक्सपीरियंस से गुजरी हैं। हम उनसे बात करेंगे एंड विल फाइंड आउट व्हाट हर एक्सपीरियंस has been like. She'll take us through her journey. Hi Lulua, how are you?
Hi Asma, thank you for having me.
No, thank you for giving us time and sharing your story. So हम अपने listeners को ये बताना चाहते हैं, this is awareness, breast cancer का month है, and you have experienced the disease firsthand. Yeah. So for those who are watching, who might want to know what the disease is, what happens, so अगर आप बता सकें अपनी कि how it all started.
Okay, so I was diagnosed in 2018, beginning in around March. So in January 2018, I was actually felt sick as in, I had fever and, it's like a flu. And then suddenly overnight, I developed a big, like a pimple on my breast. And I thought, okay, it's just happened overnight. And so I went to the doctor. And he did all the checkup, everything came negative. And he did suggest it, I'm turning 40. And he says, why don't you do mammogram? And we'll do ultrasound also. So we did ultrasound, came normal. And mammogram, they had some kind of calcification, which I didn't know what it meant. So there are levels of calcification, like 1 to 5. So when it's above 3 to 4, then there are chances of being cancerous, basically.
Calcification means hardening हो गई थोड़ी सी.
Some kind of like, I can't explain, with some kind of substance, maybe, yes, substance I would say. And so I did my biopsy, and biopsy maybe it just showed level 3. So then I sent my reports. I live in Dubai, so I sent my reports because most of my medical I do it in India, in Mumbai. So I sent my reports to the doctor, and I just happened to just go visit. And he saw, and this is in a matter of few weeks, and he says the calcification level is 4, and they did a thorough ultrasound. And he says, I definitely have to cut you basically. And not till I was under the knife. After my surgery, they actually found the tumor. So it didn't really show up in a lot of tests, basically.
Does that happen?
It does happen. Sometimes it does, you kind of miss, it does happen. So I would say I was just blessed to have found it at the right time. It probably would have grown and I would have been stage 2 or 3, but I was in stage 1. So they did take out, and of course, and then I had the process of going through radiation. And my treatment was more of on tablets, not on harsh chemo. I was on radiation. I did for like 5 weeks here in Dubai.
That was because ke jaldi pata chal gaya. That was the reason.
It was, and it is exactly. So they took it out, and they had to take out some lymph nodes and everything, and then radiation ke baad I got into it's called preventive cancer chemo tablets, which I have to take for 5 years. So I finished 3 years. I have 2 more years to go, and then obviously you do your checkups, which is very important, regardless.
So yeah, you underwent through this entire thing. But tell me, you have a family, you have kids, you have husband and extended family as well. So when you found out, initial आपका क्या reaction था? What did you feel? Because this is a disease we dread. हमें ऐसा लगता है कि
it's like something never. I've been always fit. It's it is one of those things you feel that I eat pretty healthy food. I train. I go to the gym. I have a very active and healthy lifestyle. But sometimes these things happen. There's so many factors that causes it basically, and I have a very strong family support. My husband, my kids, my whole extended family. So even actually when I woke up the next morning, the doctor came and told me. So I had no clue that I went through surgery. I don't know what it was, how it went. I woke up in the morning and I was told that yes, you did have there was cancer. So
what did you think at that moment? Because zinda rahungi, nahi rahungi. Sorry, it's a very blunt question. It's a very blunt question that way. I'm sorry about it.
No, that's fine completely. There's so much thought. Actually, everything happened so fast, and it didn't process me to that level deeper till later on. Actually, so. I'll tell you why. Because before obviously everything happened, I was diagnosed and I went through all these things. In January of that year, I had signed up for a mountain called Mount Elbrus, which is in Russia. I basically do high altitude mountaineering. And I was so focused, I was training and I was so focused that I need to go and climb this mountain. So after my surgery, and probably after a month, I asked the only person I asked is my doctor and my husband. I said, I want to still climb this mountain. And both of them, my doctor said, he just said one line. He said, if something that makes you happy, go for it. And I did not ask anybody's opinion. What I did was, while I was going through my radiation and while I got onto my tablets, which took a while for your body to adjust because it's hormonal and stuff like that. You sometimes feel drained, you have no energy.
This is what I was going to ask you,
yes.
How did you feel?
I didn't, after you feel like you've lost a lot of, obviously with the surgery you lost a lot of blood, you feel no energy left, and you're just in that space, you have a very active lifestyle and suddenly everything is stopped and you're saying, okay, now where do I literally start going to the beach, just taking walks, because I don't know when I can run, I don't even know I can lift any weights. But I said, whatever I can do, I will do as per that day. So I lived by the day, literally.
And you actually climbed the mountain after that?
In 4 months. In 4 months from my diagnosed with surgery, I went in August. And with the mindset, because I was so focused mentally that whatever it takes, I'm just going to go through this treatment. I'm going to just take care of myself, rest, and I'm just going to train as much as I can. I couldn't do anything upper body because I couldn't do anything upper body. I just trained my legs, and I was just worried about carrying a backpack. And it's a difficult mountain. It's a very high endurance mountain. It takes probably around 6 to 7 days, and literally you're hiking up like for 6 to 10 hours. The last day was 14-hour summit. So, but I didn't see the whole picture. It was just literally, okay, I'll go. I don't know if I'm going to summit, but that wasn't important. I just wanted to go up in the mountains. If I climb for a day, I climb for a few hours, and that's what it mattered. So that step by step, small steps which I started taking towards, that kind of helped me. I was like, okay, now I feel better. Maybe I'll do some more tomorrow. Maybe I'll see how it goes tomorrow. And that's how I took my training.
So maybe it was the focus, you know.
It was the focus.
You actually set your mind to,
Yes.
अच्छा मुझे ये करना ही
Yeah.
है, and it took your mind off the disease.
Yes,
And
exactly. And right after I finished the mountain climb, then it hit me what just happened. It hit me like what happened 4 months ago. Like how did this happen? Why did it happen to me?
is it in the family?
It's not. I looked. I have done a lot of research. No, there's not anybody I know who's had this. So it was just like out. Maybe sometimes I don't know, my grandmother or somebody, but we don't know. So it didn't.
Normally इस तरह कहते हैं ना, if it's in the family, if it's your mother, grandmother or someone,
Right.
then your risk is a bit more
Yeah.
and all that. So how about your kids? How did they react to this entire thing? And before the kids, you said कि जो है 4 महीने बाद it actually hit you. So what did you think at that point?
I actually, it hit me, and I would say very honestly, I had gone into depression because the medicine starts hitting thing, and I was like, okay, I need to, because I had a focus and I accomplished my goal, and now I was left like, okay, now what's my next goal? What am I supposed to do? And so I started kind of going, and it says, right, I mean, when I met my onco after my climb, he says, he actually suggests, he said I didn't process the trauma. Like I had just closed it. I just was hiding it. I was like, okay, nothing happened to me, and I was like, I didn't want it a sympathy. I didn't want people to come and see me because I was sick. I wanted, like, even friends used to call me. They said, oh, can we come and see you? I'm like, okay, let's go out for dinner. Why do you need to come and see me? I'm not sick. So I used to always kind of, I was being in denial in a way. I didn't accept it, and maybe I think that was the part, like, I should have. And then I started.
Slowly, it hit you. Yeah, it hit you.
It hit me, and I started accepting it, what happened, and be little. I was more diligent about myself, about the medicine and everything, about taking care. And okay, this has happened now. It's not end of it. I'll survive, and if it happens in future, we'll survive. We'll just fight it through.
Inshallah, and you are doing well. I mean, that's also a brave front to put. Normally people, like you said, they go into depression and then they start thinking. I've done stories with women who have been thinking, "Akal ka nahi pata, you don't know what's going to happen, aage kya hoga." So we'll come to that bit later. So how did your kids and family react to it?
As I said, I have a super support of my family. My husband has been amazing support. I think even if he would have not said you can go for the mountain climb, if he had not supported me, I would have not probably, right? So my kids, I did not tell them. They knew, but that's why I would say, I think that was one of my biggest mistake. I told them literally after 9 months.
How old are your kids? Were they able to take it?
Right now they are 11 and 15. So this happened 3 years ago. But my older one, she knew there was something wrong. I wasn't the same. So she knew something I went for, and there was some surgery or minor something. She knew there's some, but she knew deep. The reason I say it's a big mistake is because they did tell me that you didn't trust us to for what you went through. And for me, I didn't want it to give a birth.
As a mother,
and I have a similar, one of my friends, she got diagnosed last year, and she did ask me, should I tell my kids? And I told her, please do, because your kids will be the biggest support. They will see your messy part, the rough days and all, but they will also be more mature and strong enough, and they will be your support.
So you're talking about messy days, rough days, and all that. So what actually happens? Are these the result
the days
of?
I can't just feel like getting up on my bed. I can't function. It's just like I'm drained. I'm super tired. I have no energy left in me.
This is a side effect of medicines, is it?
Yes.
Okay. So that is why they say chemo is really tough and all.
It is.
So, but they also talk about it affects your hair and all that.
Yeah, so I'm on my tablets. So it's very low dosage of it. So I did like have a lot of hair fall, but then as I said, I started looking into things that would be more nutritious. Like I started taking bone broth and a lot of things that gives me enough nutrients, vitamins, minerals, so I can, since it wasn't a very harsh, it was on tablets, and something I could prevent and take care of my skin and my hair.
Sorry, I'm really being very blunt,
that's fine.
and
that's fine.
the reason, and you're allowing me to do it also. I thank you for that, to probe into your life, and we are just talking about your feelings. The reason is that viewers who are watching this, who are listening to us, they would know, for example, God forbid it happens to them, their loved ones, their friends, their family, they should know what they can expect and what the person who's suffering goes through and how careful they have to be. And I really appreciate you explaining these small details on that, because as people who are family, we don't expect,
Right.
and we don't know how to handle
Yes.
a patient probably,
Right.
like not a patient, or maybe
Somebody who's going through it and
going through
stuff.
it, and how do you give your support? What do you expect them to do? What should they actually do?
It's a very good question, because over the time, last couple of years, I have in my family and also friends who have gone through right in front of me, like my eyes, and who's gone through with diagnosed, and they actually messaged me saying that, thank you, saying that I've just been diagnosed. I don't know what to do. Like it hit them, like and it was a different case. I didn't even know till I went into surgery. A lot of people obviously knows, okay, I've got cancer. Now I need to go for a surgery, or I need to do this. Different kinds of treatments, whatever it is they have. It's one thing is, its biggest support is being there for the person. It may not be that physically, but just being there mentally. I have a very far off cousin in New York, and I didn't know that till I just recently read her post, and I found out she was going through cancer, through chemo, and I just messaged her regardless every day, not just asking for how you're doing. Sometimes we don't want to know. We don't want you to tell me how you're doing. We don't want you to make us feel sick or patient. We are patients about just generally. And so over the time, we started getting close, and she started telling me stuff, what she's going through, but not directly. I'm just being there. I wanted to let her know that, listen, I'm here, and it's anything, or just do something you would normally do with a friend, basically. So
I understand. I think that kind of support probably
Yes.
is much needed. So how did you spoke about depression and all, how did you manage to come out of depression?
So when I few months after I finished my climb, I started wondering what I should be doing, because I'm a very outdoor person. I love mountains, I love hiking, and I started looking into what I can do every weekend, which helps me get more outdoors and stuff, and more challenging for me. So I started into rock climbing, which was a very technical climb. So I started doing a course in rock climbing, and I just got into it. So it's like a sports now for So now even when we go for an expedition, I try to see a mountain where we do technical climb basically. And so I challenge myself in more that, because that's my interest. And I would say anything that interests you, your passion, we forget that between our work, our life, our family, things takes over. We actually forget what we really enjoy doing. And if we can hold on and find that passion, I think that is a therapy by itself.
True. I think we do need the distraction as well, probably, not the focus on the disease itself.
Exactly. Because sometimes we feed so much negative in ourselves that if we start feeling more positive, and that's what I think. I said, "Jo hona hai wo hoga." Let me live my life in my own terms and what I like to do, and that if at the end of the day that makes me happy, I'm happy, my family is happy. And I think that's all.
You're extraordinarily brave, actually, to think, and even to think that way. It doesn't work that way for most
It is
people.
hard. It doesn't come it easy. It's hard. I'm not saying I just think and next day I'm fine. No, it's a fight. It's a struggle. And I would like to say this. It's give that time. I gave myself that time of going through the depression. I gave that myself because I said, you know what, everybody of us, we go through it. Nobody talks about it. Sometimes become a taboo that, oh, he or she is so depressed. But we all go through it. So it's okay. I think it's completely fine to accept the days you're not able to do anything. That's fine. You don't have to prove to anyone. It's a healing process. It's ups and downs, and we accept our downs and just like work through it in our own way.
It's a very motivating thing to say, and I'm sure the viewers, the listeners are going to catch on to this thing, and I hope they do that. So there's another very sensitive thing I want to talk to you about, and I thank you again. I'm going to keep on doing that because you're brave and you're letting us into your soul. I would say that you're opening up to us. But there is a major thing that happens with women too. So it's a breast that is affected, and it's body image that affects you too. Breast reconstruction, have you ever thought of that option as well?
I was being suggested, but I'm actually not ready for it because I have gone through multiple surgeries. Even besides breast surgery, I've gone through other surgeries where related to my tablets, they had to actually take off one of my organs out, and so I've been through quite a few surgeries. I'm just not ready to go under the knife again. I just need a break, a breather. Maybe a few years down the road, if I feel like it, I'll probably will. But it is an extremely hard thing to accept because you feel your body is broken, literally, especially for women, right? But then it's just, that's why you find happiness in beyond that.
True. It's a personal choice as well.
It's a personal choice, exactly. It is.
So how do you look at the support system here in the UAE, other than your family, of course? Are there support groups for breast cancer?
Yes.
We do talk a lot about breast cancer.
There's I think no, I don't. There's a breast friends. There's a whole group, where the WhatsApp group. Quite a strong foundation here. There's even through organization like Al Jalila Foundation, Breast Friends. It's a very great community where even there are WhatsApp groups. They have events where they actually I think they do probably every once in a month or something, fun activities, events for cancer survivors, and a lot of support. Like people want to know small things while they're going through. Okay, I have this reaction, I have this thing, I'm a thing, and they want to make some choices. They have options. I think it's a very big support in UAE.
So are you part of all this? Any one of them? Okay.
Yes.
You were talking to me about some run that you're going to be...
No, so I'm doing hike. I'm doing a hike next Saturday, October 30th, in support for Al Jalila Foundation. For underprivileged cancer research, for underprivileged patients. We're doing a hike, a very family-oriented hike, and it's basically...
So you're basically involved in
getting people outdoors, get some fresh air, get some activities, go for a hike. We see the UAE outdoors, and also support the cause, basically.
So that's an important thing. So I'll just move to the last few questions that are left. See, as a patient, you're worried about your health, and with such a disease, your family is also pressured and all that. So we don't want to think of finances at this point, but they do come in. They play a huge part in this entire thing. So tell me how, for example, what kind of support do you get as a patient here? Financial support. Does insurance cover treatment for breast cancer?
I think, I have not personally have gone through this. As I said, because my treatment is mostly done in India, and we have insurance. But I do know a lot of people who don't have insurance. In fact, I had in my the company we had one of my secretaries. She had leukemia. She had cancer, and she was quite supported by the government. here because she didn't have the whole thing, even beyond the insurance. So I think they are, and also there's a lot of communities like, the religious communities, the people coming together and contributing. So there's so much, especially I feel in UAE, events like this, like how we do hiking or run or any sports events we do to support as charity, we are actually raising funds for people who don't able to afford it. And there's a hospital in Alain,
Tawam.
yes, and I believe they are also a big support, as in like people who cannot afford
They
it.
specialized in cancer treatment and all that.
Yes.
Yeah. So I mean, finances are the last thing one wants to worry about when they say,
yes.
but it does kind of fall on your
does,
head,
it does.
and
It
it takes a
is- it's
huge
a bit,
chunk of
of
your
course.
saving if
Yes.
you have any. So what are you planning next for a hike and all that?
Well, I don't know. Next year, maybe haven't decided, but probably more mountains, maybe in Nepal or something.
More power to you.
Nepal.
Oh my
I haven't
God.
been to Nepal, so I would definitely want to go. And I don't know, maybe Pakistan.
Maybe you're most welcome to Pakistan to
Yes.
do it. Yeah. So anyway, we wish you best of luck.
Thank you
And
so
again,
much.
Thank you so much for taking us through this journey of it.
Thank you.
And we wish you more power. We wish you so much of positivity that you're giving, more of it. And the listeners or the viewers are going to be, I'm sure, taking this positivity with them. आपने देखा, आपने कहानी सुनी लुलू की. सो ब्रेस्ट कैंसर एक ऐसी डिजीज़ है जो ना रंग देखती है ना नस्ल. बस औरत हैं, अगर ब्रेस्ट कैंसर का रिस्क बहुत हाई है. और पिंक क्यों होता है ब्रेस्ट कैंसर की अवेयरनेस के लिए? जब भी आप देखते होंगे कलर पिंक रिबन इज़ यूज्ड. मे बी वुड यू नो द रीज़न फॉर इट? दे यूज़ पिंक. I think basically pink is to raise awareness of it.
Feminine thing.
Color as well. And Estee Lauder, the lady who does the makeup, and she's the one who actually made it mainstream.
Okay.
So she supported this cause. It had started in the 1980s or early 90s, I think, kind of. So they started sending out these peach-colored ribbons to raise awareness about breast cancer. And then when Estee Lauder, she herself was a survivor, is a survivor, she took the cause mainstream when an interview was done for a magazine. So they turned the color into pink, and since then it's pink. It's come the color for breast cancer.
I do want to say one more thing. Is like, as I said, we don't think it's going to happen to us, and we think it's okay. It's it's a family or a friends or stuff like that. You never know what life is there in store for us. Get checkups. It is so important. We find excuses with work and we don't have time and stuff, but it's so important, especially to get a regular checkup done and thoroughly getting your mammogram, your scan, everything, blood tests. Just get a regular health checkup done, because you can prevent it. Even if you have it at an early stage, you can get treated. Then waiting, then it gets spread more in your body.
Really, that's a very important message, as you said. And women are they're the last people to actually pay attention to themselves.
We have so much responsibility. We are taking care of the family. We have this. We don't take care of ourselves, and it's so important. If the thing is that if you don't take care of yourself, how are you going to take care of your family? If you are the structure, a pillar in your family, you need to be taking care of yourself.
So actually 40 is the age actually where you should actually start going for mammogram. But even earlier than that, I mean in the UAE,
yes.
In the UAE actually in Emirati nationals, the age for breast cancer is younger than the Western, at least a decade younger. So if it's 40s in the Western world, here it is in the 30s. That kind of difference is there. So the earlier they start going for it, like you said, it is more important for them. And like in your case, you got it really early. So that is
exactly. I mean, it would have been a different, probably a different kind of a story we would be talking about then.
So just before I wind up, इस वीडियो में आप जो हैं वो मैं कॉजेज़ भी आप पढ़ सकेंगे कि क्या कॉजेज़ हो सकते हैं, रिस्क फैक्टर्स क्या हो सकते हैं. लेकिन ये ज़रूरी नहीं है कि आपकी फैमिली हिस्ट्री हो. जैसे लुलू के केस में देयर वाज नो वन इन द फैमिली. आप फिट भी हो सकते हैं. सो कैंसर कैन स्ट्राइक एनी टाइम. कहीं पे भी। स्टे पॉजिटिव, जस्ट टेक इंस्पिरेशन फ्रॉम हर, और ऐसी बहुत सारी और कहानियों के साथ। अंटिल नेक्स्ट टाइम, अल्लाह हाफिज़।